Welcome to the Brilliant Board Review Podcast, your trusted source for high-yield board prep, CME, and the latest in clinical medicine.
Let's do a little quick neuro short on intracranial pressure, because learners struggle with this, and it can make it harder to manage a patient. So management of intracranial pressure. The goal is to reduce intracranial pressure and maintain cerebral perfusion pressure, CPP. And the formula for CPP is very simple. It's MAP, mean arterial pressure. Remember, what is this one? 2/3 diastolic minus 1/3 systolic minus, that's your MAP. Remember your BP cuff, it gets the MAP. Did you know that? When you're doing an automated BP cuff, it gets the MAP and it calculates and interprets with the systolic blood pressure and diastolic blood pressure is from that. So CCP equals MAP minus intracranial pressure. Now, what is in the brain? First you got the helmet, the skull. And we're talking about adults, not children. And roughly the brain is about 1,400 milliliters. And CSF's 150 milliliters in the skull. And blood is about 150 milliliters in the skull. Remember, you got that helmet there, and the brain can't expand anywhere outside the helmet. The helmet, in most cases, the skull, is not going to expand outward in an adult. Unless something weird is going on. 99.9% of patients, the helmet is not going to expand out. So it's a helmet. It's on there at the skull. And if it doesn't, if it expands out, it doesn't like it, and it causes injury. So what can we use? So sedation, decompressive craniotomy, and steroids, all these things can help us. So, and we'll talk about each one kind of individually. Remember, cerebral perfusion pressure, it's a measurement of pressure gradient that drives blood flow to the brain. So this is super important. Remember, we talked about perfusion from the heart. Now we're talking about perfusion for the brain. And here again, it's calculated for making the difference between the mean arterial pressure minus the intracranial pressure. So how can we reduce in brain? How can we reduce? We can't just chop out the brain size. So you can do a decompressive craniotomy. So if the brain swells out, you let the brain swell, and then you put the cranium back on. This is a neurosurgeon's going to do this. You're not going to do this bedside. But we can use hyperosmolar therapy. And there's two main ones. We use mannitol and 3% saline. Mannitol's kind of gone out of favor because it can do what? It can cause problems with our kidneys. It can cause problems with our kidneys. So 3% is becoming more in favor. Now, how do we decrease CSF? How do we decrease this as part of the items that are in here? So we talked about brain, decompressive craniotomy, and CSF. How do we decrease CSF? Well, we can do a lumbar puncture if we had to. That'd be emergently. Those are in critical cases. But we can have our neurosurgery colleagues place an internal ventricle drain, which allows for continuous drainage. And you may have seen those bedside before. Now, how about the cerebral blood volume? And we talked about that over here. How can we decrease that? How can we decrease it? Hyperventilation. Now, this is short-term, very, very short-term, very controversial. Not always works great, but this is just a short-term thing. You're just trying to get through the next half hour to hour. When you hyperventilation, these patients are probably going to be on the vent, which induces hypocapnia, low carbon dioxide levels, causing cerebral vasoconstriction, therefore decreasing blood flow to the brain and reducing cerebral blood volume. This is rapid, and it's emergent situations only. This is, hey, we're not going to do well right now. Just like in hyperosmolar therapy, there's another one that you can do is very high dose mannitol. Now, what's another way we can decrease cerebral blood volume? Very simple. And this should be on all your ventilated patients. And this should be in all your heads, we'll call them. Position the patient's head at a slightly elevated angle, usually 30%, can help reduce venous drainage and lower ICP. Reduces venous drainage resistance and lowers ICP. What's another thing we can do? Sedation. Propofol Versed can decrease cerebral metabolism and potentially reducing cerebral blood volume. So this is just a quick little snippet of how to manage a very difficult topic and something that a lot of people don't get exposure to unless it's too late.
Thanks for listening. Visit brilliantcourses.com to learn more and claim credits for this educational activity. See you next time.